Good afternoon, everyone. My name is Servando Hernandez Vargas. I'm a PhD student in the laboratory of Dr. Alia Sarinia at the Montgomery Medical School in Houston, Texas. And today I have the pleasure of speaking on behalf of my group on the optimization of a fluorescent somatostatin analog for high contrast intraoperative imaging. The authors involved in this work have no financial relationships to disclose. Our group is very interested in the development of novel treatments for neuroendocrine tumors, which is a family of slow-growing and indolent neoplasms that originate from neuroendocrine cells primarily in the pancreas and in the gastrointestinal tract. And spontaneously, they have a tendency to metastasize to the liver and to the lung. As it is the case for most solid tumors, surgery is the only curative treatment for these patient populations, and surgeons oftentimes have faced the challenge of localizing the complete bulk of the disease due to the multifocal nature of these neoplasms, as well as the small size of the tumors, which have a tendency to be less than 2 centimeters. And the challenge of removing the whole disease is reflected on the fact that about 15 to 45% of surgical cases have incomplete resections. And mainly because of this, there have been significant efforts to introduce into the operating room emerging imaging technologies in order to help surgeons localize these tumors more completely. One of the critical aspects from neuroendocrine tumors is the fact that they overexpress the somatostatin type 2 receptor. And because of this, there have been significant efforts to develop agents that can specifically target this receptor. And one of the paradigm shifts came over 30 years ago with the introduction of the synthetic somatostatin analog octreotide, which has been the foundation of many eventual radiolabel agents that have entered the clinic. And here exemplifying the positron emitting tomography radiotracer gallium doratok, which represented a paradigm shift for diagnosing, staging, doing surgical planning, as well as post-operative follow-up. Unfortunately, gallium doratok cannot provide real-time visual information during resection of these tumors, and because of this, our group was then interested in developing a gallium doratok analog to provide surgeons that real-time visual information in the operating room. And here we have the schematic of the synthetic scheme that we have developed, where we aim to minimize any type of structural changes from the parent compound. And here we can see what we call a radioactive linker, the multimodality chelator, or MMC, which is a DOTA analog that now enables us to conjugate, in this case, the near-infrared fluorescent dye, IR dye 800. And we have previously shown that with the use of this strategy, we retain high tumor targeting, as shown by staining of human biospecimens, and as well as confocal microscopy. And in this case, we use a pancreatic neuroendocrine tumor, freshly resected pancreatic neuroendocrine tumor. The objective of this work was then to evaluate whether the switch from 800 to a sweeter ionic dye, that is a dye that has a net neutral charge, could perhaps improve the in vivo pharmacokinetic profile of our fluorescent agent. And to achieve this, we have collaborated with the Schneerman Group at the National Cancer Institute, who focus on the development of novel fluorescent dyes, and they have found this candidate FNIR tag, which they have previously shown that antibody conjugates retain high tumor uptake, but it reduces significantly the background and also importantly the liver. So we were very interested in evaluating whether this could also hold true if we conjugate this into the MMC. And here we can see that the FNIR tag, which I will refer as FNIR for the remainder of the presentation, retains the core of the chromophore of the heptamethylcyanine dye. However, we see that there are significant modifications in the indolenin nitrogens. We have a couple of polyethylene glycols, as well as in the C4 prime position now, instead of an O aryl, we have an O alkyl, as well as a tetraalkylammonium functional group that serves as the bridge for bioconjugation. So we hypothesized that with this agent, we could retain high tumor targeting while also reducing the non-specific binding for improved image contrast. Let me check how I'm doing on time. I will briefly, I'll just skip this slide, but here pretty much we're showing that both MMC conjugates retain the same emission and absorption maxima of roughly 775 and 795 nanometers. And also we see that both agents can provide the same fluorescence using phantom imaging. In vitro performance, we also perform a series of assays, including radioactive uptake, fluorescence uptake, and we found that both agents perform equally in regards to targeting the receptor of interest, and this association is receptor mediated because we can block it, as well as there is negligible association in the absence of the receptor, and both agents can readily internalize. But I think the most striking results are found definitely in vivo. Here we have a cohort of mice that have been subcutaneously xenografted with human colorectal carcinoma cells that overexpress the somatostatin type 2 receptor. We performed 2 imaging time points in vivo, 1 hour and 3 hours after injection of 2 nanomoles of either the 800 or the FNIR tag conjugate. And we can see that first, with the 800 conjugate, really at 1 hour nor at 3 hours, we're able to localize really any type of tumor or any other structure other than the contour of the mice. In our previous studies, we have shown that we gain the image contrast at a delayed time point, either at 24 hours or even further. But by contrast, FNIR tag provides tumor contrast to some extent, even at 1 hour. We can also begin to discern the kidney location, but it is at 3 hours when really we see that there has been a significant reduction of the background signal, and we can clearly delineate the tumor for all mice in this cohort and also for the kidney. When we look at the multi-scale imaging, we can see that ex vivo imaging using the Bruker system, we have previously also shown that the 800 does have tumor accumulation, and it is comparable to that of the FNIR tag, but the clear difference between the 2 conjugates is in the amount of background fluorescence that FNIR tag clearly reduces. And it is important to note that this is occurring in sites of primary tumor, as well as sites to which neuroendocrine tumors typically metastasize. So this is very interesting. When we perform mesoscopic imaging, once again, we see that both agents accumulate highly on the tumor, but the real difference comes with the amount of background signal that comes with the 800 version. When we perform image analysis, we see that this is in agreement to what we can visually appreciate, high tumor uptake for both agents. However, we can see that all across FNIR tag has a significantly reduced amount of background signal, but I think that the clear appreciation of how much this change is when we studied this graph where we are showing the percent radiance change, where pretty much we are measuring how much the difference there is between FNIR if we fix a MMC 800 top. Once again, we see that the tumor uptake is retained. However, the real difference comes with the reduction of the background, that it is actually more than 30% for most tissues and even 50% for some of the areas that surgeons have high interest to visualize during tumor resection. And what this translates to is the fact that we're gaining over a tumor to tissue ratio of more than 5 in several tissues of interest in the field of neuroendocrine tumor surgery. And it is interesting also the fact that we're beginning to gain contrast in the lung and in the liver, that despite the fact that it is not over 5 as it is for the rest of the tissues, this could also have strong implications for this patient population. So in conclusion, we have that the modular design of the MMC enables a facile dye upgrade that we will continue to investigate as we move forward with this project. The conjugation of a net neutral zwitterionic dye, in this case of FNIR tag, retains the tumor uptake and significantly reduces the non-specific binding that leads to faster clearance and potentially enable early time points for surgery. And finally, we are in the process of looking what type of effect does the dose and the imaging time point may have on image contrast. So at this point, I would like to acknowledge the Astarina Laboratory, as well as the Schneerman Group, and also our funding agencies. And at this point, I would be more than happy to address any question. And also on the first slide, I have left my email in case there is any follow-up question that needs to be addressed. Thank you so much.